Hi everyone. Welcome to the second day of our virtual workshop on Pan-Canadian Health Information Exchange Standards. My name is Linda Bird. For those of you who don't know me, I'm an adjunct assistant professor here at the University of Victoria, and I'm also an active health interoperability standards implementer and advocate, particularly in the areas of SNOMED CT and fire. I'm also the instructor for UVic's HIMP 537 course on Health Information Exchange Standards, which is hosting this three-day workshop series. So a very big welcome to everyone who's joined us. But before we get started, let's begin with our territory acknowledgement. We would like to acknowledge and respect the Lekwungen peoples on whose traditional territory the university stands, and the Songhees, Esquimalt and Wasanich peoples whose historical relationships with the land continue to this day. So we had a fantastic workshop yesterday focusing on Ki-High standards and social determinants of health. And so I'm looking forward to what day two has in store. We're in the middle of the overall program, and today's focus is on Canada Health Infoway's data standards. Following the presentations at around 6:30 Pacific time, the students in our HIMP 537 course will stay online and we'll be doing some hands-on activities. Today, we're going to be mapping between exchange standards, mapping between terminologies, and creating some SNOMED CT value sets for allergies and intolerances using the ECL query language, which I think will be fun, and I hope the students do as well. Now, if you're wondering how you can join the fun too and get some hands-on experience to better understand these interoperability standards, you can enroll in the University of Victoria's Certificate in Health Terminology and Interoperability Standards. This is a one-year part-time program with 4 graduate level courses done through weekly online evening classes, plus this virtual workshop that you're in right now. This is the only terminology standards program in Canada that's accredited with CHIMA, the Canadian College for Health Information Management, to become a certified terminology standards specialist in Canada. So if you'd like to join our September 2025 intake, please apply by June the 1st. And to find out more, you can either scan the QR code or visit our website at uvic.ca/HIMF and then click on certificates. But coming back to the workshop agenda for today, here's today's lineup. We have 5 fabulous guest speakers from Canada Health Infoway today. Anil Patel, Janice Spence, Myriam Talantiki, Alex Rees and Sonia Balga. But first up, we have Anil, Janice and Myriam who will be telling us about the Canadian Standards Release Centre and how they are advancing interoperability through standards development and application. So who are Anil, Janice and Myriam? Well, Anil Patel is the Manager of Standards at Canada Health Infoway, bringing over 25 years of experience in health informatics, clinical terminology and digital health interoperability from the US, Canada and the UK. Anil represents HL7 Canada at HL7 International and is a member of the Terminology Service Management Group. Anil also represents Canada at LOINC for the Laboratory, Clinical and Document Ontology Committee and is a committee member of UCUM. Anil has a Bachelor of Science and a certified terminology standards specialist. Janice Spence is our next speaker. She is a senior standards specialist with the Canadian Standards Release Centre at Canada Health Infoway. Janice has over 20 years experience in health information management, health informatics and data integrity management, as well as interoperability standards development and application at both provincial and national levels. She is a health terminology standards subject matter expert with a specialisation in SNOMED CT. She's a SNOMED CT certified level 2 content author representing Canada on SNOMED International's content managers and e-learning advisory groups. And she has a Bachelor of Science and a wide range of certifications, including being a certified health information manager, a certified terminology standards specialist, certified professional in health information and management systems, and a Fire Release 4 certified. And last but not least, Myriam Talantiki is a standards specialist with the Canadian Standards Release Centre at Canada Health Infoway once again. She has a bachelor in microbiology and immunology and a master's in public health, specialising in epidemiology surveillance. Myriam brings expertise on vaccine-related content for SNOMED CT. She has a Master of Science and an MBA. So just to summarize that, we have a lot of expertise in the room, and I'm therefore absolutely delighted to introduce you now to Anil, Janice, and Myriam. Over to you.
Thank you. Let me just get the sharing done. Can you see my screen?
Not yet.
Not yet. Okay. Let's see.
Typically
Can you
select
see
the
it now?
screen. Okay. Not yet.
Ooh, I hit the
There we
share
go.
button.
There we go. Yeah. Yes. Perfect. Thanks, Anil.
Okay, thank you. Well, thank you. Welcome. Good morning. Sorry, good afternoon or good evening, depending on where you are. More admissions. Let me try and get those too.
I'll handle the emissions, Anil. Yeah.
Okay, thank you very much. Okay, we will thank you, Linda, for presenting the agenda for this afternoon and also introducing us. So the agenda for this part of it, the first part of it, is the Canadian Standards Release Centre, who we are, what services we offer, what's on the horizon. And then, there'll be a dive into the overview of the Health Information Exchange standards and the role in interoperability, followed by interoperability standards in action. We'll see the National Vaccine Catalogue and also the terminology server. And if we have time, maybe even a demo for that too. So thank you, Linda, for introducing us. So I will skip past this slide. Now, who we are. Infoway's mandate is, national leadership role in accelerating collective digital health efforts, right? And ensuring that a pan-Canadian vision, strategy, and architecture and plan is in place. And it's ensuring national standards and common understanding about privacy and security. So it's not just about health terminology standards. Infoway's Canada Standards Release Centre in that role plays a vital role in advancing the adoption of pan-Canadian and international standards to ensure that the semantic interoperability in the digital health ecosystem. The standards we provide can be bucketed into 4 groups, which is, publication and distribution, the terminology services that we have, the support and education we provide, and representation. When you look at the publication and distribution, we release Canadian-specific versions and extensions of the core standards like SNOMED CTCA edition, Pan-Canadian LOINC Observation Code and Database, or sometimes called PLECLOD, the Canadian Drug Dataset, CCDD, HL7 code system, too numerous to name. And up on the horizon is the Canadian Medicines Terminology, CMT, which is in development. And all of these are in English and French descriptions. The terminology services that we provide through our National Terminology Server solution, we offer sort of FHIR terminology services. We host value sets, maintenance meaning that, we also do some translations and authoring of it, browsing, and you have syndication services so that you can have system integration. And we also offer an API access, so you can have a sort of a programmatic way of querying these nationally approved standards and value sets, through Postman and things like that. We also support education and we provide sort of a technical guidance. So you can see on the InfoCentral where we have provided the guidance through community engagement, like HL7 working groups and, the health terminologies community. And we also provide education support around the standards implementation and use. So you can always send us a question and we'll answer it and we'll get back to you. The other thing that we do is representation. So we represent Canada's interests at the International Standards Development Organizations, or the SDOs, ensuring that global standards address Canada's Canadian clinical, technical, and business needs. InfoCentral, if you go to InfoCentral, it's a collaboration hub, and there are sort of working groups, there are communities, and of course, there's this Canadian Standards Release Centre. The communities provide an opportunity for people to collaborate and communicate on, interoperable topics that are of interest to them and their peers on an ongoing basis. They sort of foster us open, inclusive participation, and we encourage diverse perspectives on that. The communities, provide a space where you can share news, attend education centers, connect with experts, and host meetings. There are lessons that, we've heard from other jurisdictions or vendors, and those are shared there too. And also through the communities, there's historic information of presentations that were done previously. The types of communities that we have, vary. They may be domain specific, like medication management or enterprise architecture, imaging, but they may focus on, specific interoperable priorities, such as secure clinical messaging or secure patient summaries. And they may focus on standards, like HL7 Fire or others. And they can be formed by, professional groups such as a community of nurses or physicians, so these communities are open. And so you can see here, the Canadian Standards Release Centre on the right-hand side, you see SNOMED CTCA, and there's sort of, you can download them. You can see other additional information if you go to there. And there's a link provided at the bottom of the page where you can get to these. There's also PCLOD, which is our most successful standard, used across Canada. And I'll be diving into that a little bit later on. When you think of standards, Infoway provides sort of a convenient way to access a wide range of license and proprietary material. And, you can get we have various agreements that we have to sort of adhere to. And with an Infoway account, you're asked to reconfirm every year, by March 31st that you are okay with the user agreements. All the SNOMED CT, LOINC, and Infoway software tools available on it are at no cost to the users. And all you need is an active Infoway account. The content development part of it, if you want content developed, comes through a process where you request a submission through Informs, which is a Jira application. Okay, so you can ask for SNOMED CT, LOINC, or Pan-Canadian subsets. And on the right-hand side, you can see, you can track them in Jira. You can see here in the top part of this, there is SNOMED CT, content that's being developed. So you have access to it. In the middle there on the right, you can see PCLOCD requests that are available. And through that, you can actually have a look to see, is your content also being developed, or do you need to request something new? We do a duplicates check also to make sure that, two people aren't asking for the same thing. And on the bottom right, you can see, subsets or value sets, as we call them now. In order to be able to do all of this, we have some terminology authoring tools. And on the bottom left, the SNOMED folks use TermSpace, which allows them to do some CT authoring within that. We also have a custom-based tool, which is called CLMS, which is the Canadian LOINC maintenance system. And that allows us to develop LOINC codes and manage, content that is being requested, and also pull in information from LOINC and do the translation and substitution, because remember, our content is both English and French, and these standards are typically in English. As I mentioned, we do release management here too, through the terminology server content, okay? And on the terminology server, we have SNOMED CTCA, LOINC, we have PCLOCD, okay? So there's differences. UCOM is there, and Pan-Canadian value sets. So we don't have jurisdictional or specific ones, but Those that are used across the country for all users are hosted on there. And we also have Canadian clinical drug data set. On the top right, you can see an idea of, the OntoServer dashboard. And I think we'll be going into that deeper if we have time. And it allows you to get access to all sorts of information, a very open tool. There's also syndicated onto the HL7 FHIR domain. So it's not just available to Canada, but available globally now. And to be able to, you can query the information through the SNOMED CT browser, and you can, if you pick the Canadian edition of it, you can then be browsing just the Canadian specific terms, and they are, combined with the international. What's on the horizon? This is long term. The CRCC continues to focus on increasing the adoption and maturity of our terminology server. And while we're preparing to decommission the terminology gateway by April 2025, that's just a few days away. And upcoming efforts that we have are, national releases, the SNOMED CTCA, PCLOCD, and also raising the awareness of standards. So enhancing education and training material. There's a lot that we're trying to do. And the team is also expanding services to align to the interoperable roadmap. That is supporting standard adoption through guidance documents. Recently we produced a document that allowed jurisdictions to move their jurisdictional value sets to pan-Canadian. There's also tooling access, like AI Scribe. And we continue to want to engage, user groups such as clinicians, vendors, and policymakers. These initiatives reflect Infoway's commitment to advancing interoperability, so improving data exchange and fostering high quality, innovative healthcare solutions. On the shorter horizon, what we are going to do is looking ahead. The CRC is focused on advancing the national interoperability through curated, aligned, and content which supports FHIR-based exchange. Also, enhancing automation and accessibility of the standards through our modern tooling. Showed you OntoServer, but also, we have the FHIR Simplifier, which is a web-based collaboration platform for FHIR, and APIs. So now you can automatically download and syndicate all your information. We're also strengthening our partnerships with jurisdictions like Canadian Institute for Health Information, CIHI, and implementers so that we can co-author value sets. We work with CIHI and others, provide profiles and, FHIR implementation guides that reflect Canadian priorities like IPS, e-referral, and e-consult. And it's through our interoperability roadmap that the CRC plays a critical role enabling the role in the transformation of Canada's digital health ecosystem. And this is by ensuring the health information is structured, standardized, and shareable across systems and boundaries, okay? That's the role that we have. And we're helping to build a more connected, hopefully responsive, and patient-centered health systems for all Canadians. Any questions? Okay, I will turn it over to Janice. I'll navigate for you, Janice.
Thank you so much. And hoping you can hear me okay.
I can hear you perfectly.
Great, thank you. So for this section, what I'd like to do is to go over a little bit more in depth into some of those standards that Anil discussed as part of our role as the Canadian Standards Release Center. So looking at some of the key interoperability standards that we support with, more importantly, some real world examples of how those standards can be applied. So my colleague Myriam will go a little bit into the National Vaccine Catalog, and then I'll also take you through the National Terminology Service that we've recently launched. Next slide, please, Anil. So first, let's take a look at interoperability. And I know many in the audience, we've probably heard this term bandied about often, might have gone in depth into what it is. You know, some of us might go a little bit deeper, some know notionally what interoperability is all about. But this is an educational program. We thought that it's wise to sort of revisit what we're talking about when we talk about interoperability and where standards play an important role in this. So effective delivery of care requires interoperability, which essentially is the seamless flow of information between different solutions and devices, enhances continuity of care, collaboration between health care providers, patient access to their own health information, and essentially reduces inefficiencies within the health system. So when we talk about interoperability, there are kind of two key domains, and that's the technical connection, the sort of syntactic component of interoperability, the switching on system, turning on the lights, making sure systems talk to each other, and then the underpinning data that gets interchanged. And then with that, there are 4 levels to interoperability. And these levels are generally well understood and accepted. HIMSS is usually a good source of truth for what defines these levels. And this is sort of what we're leveraging as part of our own work. So the first level is foundational. So this is establishing the interconnectivity requirements needed for one system or application to securely communicate data and to receive data from another. And essentially, this can be considered the easiest to achieve through technology. So this is where systems integrators come into play. The second level is structural. So this is where format, syntax, and organization of data exchange, including at the data field level for interpretation, is involved. And this is where standards play a key role at this layer as well. Standards such as the content and data exchange standards are sort of work symbiotically to make this happen. Data exchange standards, I've given a few examples here, which is HL7 FHIR, V2, DICOM, and IHE. At the third level, the semantic level, this is where you get provision of common understanding of underlying models, codification or structuring of data, including the use of data elements with standardized definitions from publicly available value sets and coding vocabularies or terminologies, which provides shared understanding and meaning to the user. So this is essentially how I like to ascribe it as where the rubber is hitting the road to interoperability at that semantic level. And this is where content and terminology standards are absolutely key to achieving this. And some examples, as we've touched on before, it's like SUMID-CT, LOINC, and the Canadian variations of that, SUMID-CTC and PCLOCD. CDA is also a good example of a content standard that's well defined in the healthcare space. And then at the fourth level, it's organizational. And the organizational level interoperability, I think, is least often discussed, but it's also just as crucial. And this is where governance, policy, social, legal, and organizational considerations that facilitate that secure, seamless, and timely exchange and use of data, both within and between organizations, are enabled. These components enable shared consent, trust, and integrated end user processes and workflows. And this can be considered a crucial lever to actually achieving the other 3 layers, particularly when we consider wanting to roll out interoperability at a national scale, like we're doing here at Infoway. So it's really the ability to for health information systems to work together across organizational boundaries to provide continuum of care for individuals and communities. So it's eliminating a lot of those governance and policy barriers that would exist, for example, across the provinces and territories of Canada. Connection, collaboration, and communication has never been more important for the health system. Increased use of virtual care has highlighted the need for safe and efficient electronic sharing of information across the circle of care. Continuing to improve Canadian healthcare would necessitate the work in interoperability, because as you find out more from Alex's delivery, when we talk about connected care systems, we're talking about healthcare systems, which is the end goal of our roadmap. Next slide, please, Anil. Thank you. So as a terminologist, I would be remiss not to go a little bit deeper into the semantic layer, looking more closely at semantic interoperability. And this is where, as I mentioned before, the application of terminology standards becomes crucial for realizing interoperability that has a semantic framework attached to it. And I've used just, this is an often used example to give context because it resonates most often with folks where you're trying to convey a simple concept like a cold. And this can be conveyed in several different clinical contexts. So if you're exchanging this, it is absolutely crucial that the clinical context that's intended remains and the data integrity is not changed and ambiguity is not layered in by, not having a standardized layer attached to this data. So the clinical context is we're making sure that the clinical context is well defined and the meaning is not lost. And I've just given an example here of how a simple cold can be, and this is just three of other types of clinical context that could be applied to a cold. You could be talking about the environment that the subject of record is in. You could be talking about an exposure to a cold event, or you could be talking about the disorder of the common cold. So this is where terminologies play a crucial role in eliminating any ambiguity in clinical context as data is exchanged. It usually represents the main challenges of systems, and that is why the work that we do with the role of enhancing, adapting standards, it's important to making sure that we achieve this. Next slide, please, Anil. So here we want to talk a little bit about why interoperability matters. And I know it's a bit of preaching to the choir because a lot of us here on this call understand the finer points of interoperability, and more importantly, where there's a lack of it, what can happen. So imagine a family physician wants to communicate with a specialist in another practice, but they have different solutions. While some solutions offer secure messaging capabilities, most cannot communicate with all other systems. Instead of collaborating directly, clinicians develop workarounds using outdated technologies. And dare I mention, like the fax machine, although I know we're trying to get away from that, but it is still a salient example in how we have breakdown with data silos still involved, where there are efficiencies and redundancies still in the system that can only be eliminated when we have an interoperability approach. It improves the continuity of care, breaks down data silos, and reduces inefficiencies and redundancies. And I think those are some key takeaways when we talk about why interoperability matters. And more importantly, there's a paradigm that is well known where we talk about, collecting data once and using many times for various purposes. The application of standards, this is where interoperability actually becomes a mover and shaker of ensuring that data freely moves around and is still secure and still accurate. Next slide, please, Anil. So this is to give a real world example of where interoperability or the lack thereof in terms of having gaps in connected care can have negative impacts on our healthcare system. So where it serves to make a real difference is improving patient care through access, productivity, and quality of the care delivered. So in this example, it was a survey of clinicians who determined that a lack of integrated care system results in missing information, which impacts level of care received and ultimately patient safety. So we're looking at figures like over 9 million Canadians experiencing at least one gap in communication which affected their care. Clinicians reporting spending over 30 minutes a day searching for that missing information. So a direct hit to productivity and ultimately patient care here. More recently, there's a report done by a clinician task force called the Digital Health Interoperability Task Force, which outlined challenges due to lack of interoperability from the physician perspective. And over 1/3 of physicians who use an AMR reported that they could spend over 2 hours or more beyond what they should reasonably spend each day looking for patient information needed to provide care. And of all the numerous barriers reported as preventing access, use, or getting full value from digital health technologies, the lack of integration with current systems, having multiple systems that aren't connected was the most commonly identified factor. And this is by 73% of the respondents that were surveyed as this task force. So it's a real, particularly on the clinician front, it's felt, it's a real world dilemma. And we're here to help to provide the tooling and the technology to facilitate, making the path easier for interoperability to be rolled out in Canada. Next slide, please, Anil. So a little bit on health terminologies, and I know this course, how you have dedicated courses that go in into the depth and breadth of terminologies like SIM and CT, LOINC, and data exchange like HL7 FHIR. But we thought we'd cover it as sort of the springboard for some of the initiatives we'll talk about later on. So when we talk about health terminologies, one of the key things I think we always need to consider is that it needs to be a fit for purpose terminology. There's no one terminology or health terminology that fits all. And the relevance and importance of the terminology depends ultimately on your use case or your goal. So different healthcare terminologies will fulfill different distinct purposes. And if you look at the examples that we've given here, key examples of use in Canada for lab tests, clinical measurements, clinical documents, survey instruments, there is LOINC and PCLOCD. For clinical data, well known for diagnoses, problems, procedures, organisms, etc., it's SNOMED-CT. And for drugs, we also in Canada have CCDD, which is the clinical data set that's also managed by Infoway. LOINC, of course, is all about measurements, and they factor into one piece of the interoperability puzzle, often working quite well with SNOMED-CT. And of course, SNOMED-CT having a richer semantic framework, being polyhierarchical with a full taxonomy, is also good for ensuring management, analytics, clinical information sharing, secondary use such as research, analytics, population analytics. And so it's a very fulsome and rich terminology that also adds to the value proposition of having terminologies combined for data sharing. And next slide, please. So I thought this was a really good sort of visual capture of when we talk about the role of health terminologies, like who is it impacting? What are the benefits? What's the value proposition of everybody who is in the digital healthcare landscape? And this was at the recent General Assembly for SNOMED-CT, where they sort of gave you a view depending on your role in the healthcare system, from the citizen who is often a subject of record or a patient, to the health personnel, government, researchers like scientists, and of course vendors. And they all have a stake in the interplay of the digital health ecosystem. So it does not just mean more standardized seamless data exchange, but it has benefits to impact all players in connected care, so both for direct care and for secondary use. And next slide, please. So when we talk about health terminologies, data capture, data entry, and an enabler for integration is very important to understand. So health standards used in Canada provide that clinical terminology and systems communications that enable thousands of healthcare providers across the country to communicate and share information in a consistent, unambiguous, safe, and reliable manner. These standards are essential building blocks to a health data platform that will lead to better data exchange and, more importantly, actionable insights. So the data then becomes actionable and not just data that sits in a repository that's not usable. It can provide insights for all care settings, from primary care to acute care, from the underlying health information architecture, which includes layers. And I'll just touch briefly notionally, because I know our High colleagues would have gone into some of this as part of the Pan-Canadian Health Data Content Framework, where we talk about layers of, data, application, and the logic layer, which should frame out an infrastructure for an integrated care system. So the data layer is standardized in terms of format, nomenclature, terminologies, and definitions. And this is where data exchange and terminology standards eliminates that interoperability friction and the need for bridging between systems. So I know we talk a lot about mapping between systems and sort of translating from one to another, like FHIR would have the notion of concept maps. But the more terminology that we apply at source is the more the need for these bridging initiatives will be applicable. So the data layer, having that terminology applied, is crucial. And separating this data layer from applications is achieved by putting that semantic common data model that references a set of ontologies at the center of the design for each and every use case. So making it that semantic richness sort of agnostic to any technology that you would apply at the application layer. And next slide, please. Just another example of, purposes and value added for health terminologies, and that's sharing information in multiple languages. In Canada, this is a crucial use case. We're required to have, for a lot of our data exchange instances, the ability to exchange data in both English and French, which both our main terminologies have now been, have made quite an inroad into becoming more and more bilingual over the past few years. So this is just an example of how that data moves with synonyms that would afford us to move data in multiple language. Heart failure is not just heart failure. You could have your French translation attached to that as well, which is crucial to ensuring that the data integrity stays intact even when we're changing languages. So safe and secure exchange of health information supports clinical decision support like alerts and reminders. Of course, synoptic reporting is another valid use case. Population health management, such as for screening and public health. We saw how useful during the COVID-19 pandemic, how useful it was to have standardized data and how quickly we had to set in motion a lot of initiatives that sought to structure lab data for sharing with patients as an example. And of course, data analytics, which is always needed as part of health system management. And this is where terminologies can play a key role in that. And next slide. So we'll go a little bit now, the next few slides, just to give you, just to highlight some features of the terminologies that we maintain at the National Release Center. And these are the Canadian constraints for two major terminologies, and that's LOINC, and for Canada, that's PCLOCD, and then a bit of into SNOMED CT Canadian edition. So Anil, I don't know if you want to touch on these two slides for us. Thank you.
Yeah. The PCLOCD is a constraint of the LOINC. We say lab LOINC, but actually recently we've also included documents ontology in it too, because it's really LOINC. So Infoway is a Canadian release center for PCLOCD. It's a code system. I mean, some people might call it a subset, but the fact that we add translations and viewer names and other things to it, it's probably okay as a code system. It's the largest lab terminology in the world for some clinical documents too. It's US English and French Canadian, okay? And within the PCLOCD, we also have recommended units of measure, like UCOM. And twice a year, we come out with a release, which is March 31st and September the 30th. May come out with quarterly, but I think at the moment, twice a year seems to be sufficient, and it is one of the most successful standards implementations here in Canada. So in the March 2025 release, there were a total of 40,000 codes, which is about 40% of what Loink has. Loink has about 110,000 codes. 97% of it is translated into Canadian French. The bit that isn't at the moment is the document ontology, and that will be in the next iteration. And as I mentioned, and as it says here, the expansion of the Loink document ontology, we've added about 1,173. They came essentially from BC, Ontario. Their requests were added, but we can add more. I think there is capacity to add more to it. There were also 2,180 PCO-CD attributes added, which reflect the Loink and SNOMED collaboration that's going on. And these enhancements were added to the latest version of the Loink 2.80 release. There's ongoing work with that, and we will try and stay abreast of it. Any changes that do happen, we want to make you aware of them before they get implemented.
Thank you, Anil.
Okay.
And for SNOMED CT, I'll just give you some key highlights in the interest of time. We release the Canadian edition quarterly. That's February, May, and August, and it includes both English and French. So English concepts as well as French descriptions as required by requesters. And right now we have, I think, well over 146,000 active concepts translated. So as each release goes by, the bilingual component of the terminology is increasing as well. Next slide, please. So this again, won't go into it. It's just sharing with you a snapshot of some of the statistics for our last release and what's included under the hood of that. So you can take a look at that. And if you have any questions about that, you can let us know. Next slide, please. So this slide is just intended to touch a little bit on FHIR, which for a lot of our applications now and our interoperability specs, FHIR is the underlying data exchange and works hand in hand. And we'll touch a little bit on that when we give you a sort of an overview of the terminology service that we've rolled out using a FHIR terminology server. So the next section, we're going to go into a view of standards in action. And then just highlighting some of the key initiatives leveraging terminology standards with an insight into how these standards are applied in the field. So I'll just mention the Pan-Canadian Health Data Content Framework in the context of how we support our CIHI colleagues, because I know they would have covered this with you. So we support with the development and maintenance of the standards that underpin the data content framework. So if we move to the next slide, please, Anil. This is just to give you a sort of a visual depiction of where our teams would work closely to developing this Pan-Canadian Health Data Content Framework and the products that go with it, such as the Canadian Core Data for Interoperability, the CACDI. So as part of Release 1, we worked with CIHI to develop value sets that underpin a lot of the data elements that's part of the framework. And this is just a view into the types of terminologies that would have applied to the various data elements using through the value set development work. And more work will continue as part of the CACDI version 2. And we've also shared information in the useful links section of this of the slides for you to go and take a deeper dive into these as well. So I'd like to pass it on to Myriam, who's going to just do an overview of the National Vaccine Catalog and how they've actually applied terminology standards.
Thank you, Janice. So today I'll talk about the National Vaccine Catalog and more specifically about the development of SNOMED CT-CA patient and clinician pick lists. Next slide, please. So immunization registries are confidential and population-based digital systems to track vaccination within specific regions. They enhance vaccine uptake by identifying coverage gaps and by employing reminder tools. Effectiveness of those registries depends on high quality data and interoperability with other systems. Next slide, please. So the National Vaccine Catalog is a publicly accessible repository maintained by the Government of Canada, which is used by many immunization registries. It includes information on all vaccines authorized in Canada and also gives product-specific details such as the drug identification numbers, the DINs, lot numbers, expiry dates, and also the SNOMED CT terminology. So it's the content that is leveraged from Infoway's value sets. All this is to promote interoperability across healthcare systems. So within the National Vaccine Catalog, there's vaccine DINs. So it's an 8-digit number assigned by Health Canada to identify drugs. They are linked to the specific lot numbers, which are the manufacturer-assigned identifier for each vaccine batch. Those DINs also linked to SNOMED CT train name concept and the SNOMED CT generic immunizing agent concept. Both the train name and the generic concept are linked to the antigen concept and finally associated with the disease concept. Next slide, please. So just to give you a better understanding of what content is leveraged from Infoway by NVC, sorry. So here in the table, you can see that NVC has different subsets. So for example, the train name, the antigens, immunizing a healthcare provider occupation, and they're all direct extensions of the SNOMED CTCA and the HL7 reference sets, value sets that are developed and published by Infoway. Next slide, please. So just to give you a little history behind the national vaccine terminology. So back in 2017, Ontario requested a common language because a lot of jurisdictions were using a common tool, which was Panorama, and is still used today. So Can Immunize, which is an application used by patient and clinician to track vaccination, decided to create the Canadian Vaccine Catalog. So CVC aggregates data from different sources, and it included information such as the SNOMED CT content that is developed and maintained by Infoway. So when the Canadian Vaccine Catalog was created, they found the need to have appropriate terms for patient and clinician. So they decided to create content for patient and clinician pick lists, but those pick lists were never published nor standardized. In 2024, the Public Health Agency of Canada, PHAC, created the National Vaccine Catalog. It mostly leveraged what CVC had done in the past. The only difference is that their content is really aligned with Infoway. What I mean by that is when there is new content, such as new concept, new descriptions, modification or removal, they will align with that. CVC did not do that. When there was new addition, they would align with Infoway, but if there was any modification or removal, that was the gap that was missing with CVC. When NVC was implemented, they did not integrate any patient or clinician pick list, but they understood the need to have those kinds of pick lists. The public health surveillance community really expressed their interest, and they requested a standardized pick list based on CVC content. Next slide, please. Sorry, my voice is sorry. So what are the pick lists? It refers to a list of medical terms or options used in electronic health systems that are tailored for different audiences. So here, patients and healthcare providers. It's really important to have two different pick lists because the need for each audience is different. So for the patient, they would like to have the complex clinical terms translated to something easy to understand. Usually we use lay language, avoid any medical jargon, anything that is really simplified. instead, for the clinicians, they would like to have more precise medical terminology and use more clinical details. Pick lists really enhance user experience in digital health tools. It makes it easier for them to understand. And also it supports interoperability because each term of the pick list is linked to a SNOMED CT concept. Next slide, please, Anil. So now just to give you an overview of the process for the development of those pick lists. So we created a working group that was composed of different partners that expressed their interest for those pick lists. So we had several provinces representative. So from Quebec, British Columbia, Nova Scotia, Ontario, and Alberta. We have representative from National Vaccine Catalog, Can Immunize, and obviously Infoway. The working group met every 2 weeks, starting November 2024. The clinician pick lists were integrated into the February 2025 release for the SNOMED CT-CA edition, and the patient pick lists will be integrated in the upcoming release. Next slide, please. So now I'm gonna give you more details on what has been done to standardize those pick lists. So first, I'm gonna start with the generic terms and then the trade names. So the generic terms for the clinician pick list were I'm gonna say the easiest pick list to standardize because they were based on existing preferred term in SNOMED CT. So if you see on the top, we have a screenshot of SNOMED CT browser with one of the generic term for Canada. And you can see on the right, the small black star is the preferred term. And what we did with those preferred terms is that we removed the unspecified word. We added the word vaccine, as we can see in the table at the bottom. And we also added the FAC abbreviation of the disease in brackets. We thought that it would be an interesting information for the clinician to have. Next slide, please, Anil. So still for the clinician pick list for generic terms, we decided to keep all levels of concept and all the detailed information. So in this table, we have some generic terms for the pertussis vaccine. And as you can see for the patient display, we really kept the higher level of information with no details. So the patient will only see pertussis whooping cough vaccine, but the clinician will have all the detail, all the concept that is, they have display all the details and level of concepts. Next slide, please. Now, still in the generic terms, but for the patient pick list. So those terms were more challenging because CVC content wasn't patient-centered. So for what we did for those terms is the same as the clinician. We removed the word unspecified. We added the word vaccine if it was a vaccine. If it was an antitoxin, we added antitoxin. If it was an antibody, we added the word antibody. And the only addition that we did is to add the lay term of the medical term. So as you can see here in the table at the bottom, so it's for influenza vaccine. So we added the lay term flu that is commonly known by everyone and mostly, well, patients. But as you can see, we kept the medical term because we had a lot of discussion with the group, and they decided that for education purposes, it was better to keep both the medical term and the lay term in case some patient didn't know the medical term. So that was really for education. As I mentioned in the previous slide, we eliminated all details of information, as you can see in the two tables here. So we have a lot of generic terms for COVID-19 and for influenza, but we really kept the higher level of information. Next slide, please, Anil. So now for the trade name terms, it's both for patients and clinician. So what has been decided is that we'll use the project name as it was found on the monograph. So we went to the Health Canada's Drug Product Database, DPD, and doing that allowed us to eliminate a lot of duplicates. And you must know that we don't want any duplicates because we don't want any ambiguity. But still, after doing that, there were still some duplicates. So we decided to distinguish concept that had the same trade name to add the market authorization holder, so the MAH. So as you can see here, there was two vaccine having the same trade name, Dukoral, and we added the market authorization holder to differentiate them. So after doing that, there were still some situations where we had duplicates. So we decided to add qualifiers that were not already mentioned on the monograph. So if we went to DPD, we had vaccine Angerix B, two vaccine Angerix B. One was for pediatric, one was for adults. So we added the qualifier pediatric to differentiate them. And still, we had some duplicates. So neither the MAH nor the qualifier was enough to distinguish those duplicates. So we decided to finally add the vaccine strength to differentiate those duplicates that were still there. So here, just an example about the B-Fortis vaccine with two different vaccine strengths. Next slide, please. So now it's really for the clinician, we added, like for the generic term, the fact abbreviation of the medical term in brackets. Again, just to maybe make it easier for the clinician if they look up for the vaccine by disease and not by the trade name. It's really to give an extra information for the clinician. Next slide, please. So we also did some other editorial guidelines for consistency. So we made sure there was a space between square brackets and parentheses after the following word, that the word in parentheses is in lowercase, that the first letter of the word following the brackets is capitalized in English for the English terms, but it's lowercase for the French terms. In French, all the terms were lower cases. And also Quebec team decided that they wanted to use the full medical term and not any abbreviation. So here I give you an example. They preferred poliomyelitis instead of polio. Next slide, please. So now for the next steps, we created some pick list guidelines to document any decision that were made during the process and by the working group. They're still ongoing because we're still going to publish the patient-friendly pick list. Like I mentioned, the clinician pick lists were integrated into the February release, and they can be found in the Canadian edition of the SNOMED CT browser as the concept preferred term. For the patient-friendly pick list, we decided to publish them as language reference sets. So we created two new language reference sets, so the Canada English patient pick list and the Canada French patient pick list. We're in the process of creating all the requests for change for the new description to be added, and those pick list terms will be integrated into the May release. Next slide, I think it's the, yeah, it's I'm done for my part, and I give it back to Janice. Thank you, everyone.
Thank you. I'm going to try very hard not to creep over too much into my colleagues' time, but I just wanted to give a quick overview of a key service that we've recently rolled out, which is our National Fire Service. So it's both a terminology server with the intention to be a terminology as a service platform as well. So this was rolled out back in July 2024 in collaboration with a managed service partner, Daedalus, using the platform OntoServer, which is out of Australia, developed by Saro. And it's a fully compliant terminology server with the aim to offer a centralized platform for managing and distribution healthcare terminologies. Then this includes like our SNOMED CTCA edition, PCLOCD and LOINC, as well as the Canadian clinical drug data set. So fully compliant with FHIR standards and ability to support all of the terminology resources in operation as part of FHIR terminology services. Provides a single source of truth now for pan-Canadian terminology, as Anil mentioned earlier on, replacing our legacy platform, the Terminology Gateway. And another key feature aims to support integration and syndication services, which is a federated model for ensuring that systems integrator have the latest and greatest terminologies available to them for use in their systems. Next slide, please, Anil. So why a terminology server? So servers are a good way to get high quality data out in an efficient manner. So one of the key things about servers is it allows for programmatic use, such as searches by algorithms, APIs, allows for terminology bindings for validation, and as well as supporting navigation and running queries in a standardized way. So when we saw challenges that we faced in terms of establishing consistent use of terminology at a national level, a platform that could be rolled out at scale was definitely what we targeted with the rollout of this FHIR service. So with the syndicated national terminology service, the key areas we wanted to cover was ensuring that there was a reliable and consistent service that was provided that would publish terminologies in standard FHIR format that could be available for consumption by any system, and that could be used further downstream in local installations as well. Next slide, please, Anil. So this is going a little bit more into the key features and benefits of a server, some of which I've touched on before, but I think key features is to point out is the centralized access, which is a crucial enabler of interoperability, eliminating sort of that need for every shop to have their own instances of terminologies that could get out of date very quickly. So having a source of truth repository that you can ping at any time to get the latest and greatest to be used in your system, we thought was a key enabler of interoperability for Canada. And of course, improving collaboration between systems, having a federated model where you have a source of truth terminology server to get national terminologies is important. Fully FHIR enabled, of course. A lot of our specifications are now FHIR based. So having something that's fully FHIR compliant when we talk about terminologies consumption was crucial. And of course, it helps with information modeling and specification development with the support of such resources and operations like concept maps and value sets. Next slide, please, Anil. So use cases for enabling the digital health ecosystem. So this is one of the key objectives of a national service like this is how do we enable that integrated layer for the digital health ecosystem. And it's intended for users across the spectrum, which are content authors such as standard SMEs, solution development teams, for example, Prescribe It, for Health Canada that's managing the CCDD, for example, for our partners at CIHI, for provinces and territories. It's also aimed to support spec writers, like anyone who is writing specifications like for provinces, Ontario, Alberta, Quebec, for our team that's managing the Canadian edition of the patient summary specification, as well as consumers of the content. So anyone who's interested in ingesting content or browsing content for terminologies. And of course, crucial to the success is vendors, ensuring that the vendors are involved in the actual application of the terminology server. Next slide, please. This is just to tell you a little bit about OntoServer, which is the platform chosen. we've provided some information there that you can take a bit of a deeper dive into. But a key takeaway for what OntoServer offers is that it's a turnkey service. It's fully fire enabled, so can support all fire code systems, not just SNOMED CT, which you'll see in our instance, but other national terminologies as well as value sets for use in downstream systems. Next slide. So just wanted to point out specifically some of the features that it supports when we talk about the main terminologies that we support, like LOINC and SNOMED CT. So it has a very rich support for SNOMED CT with embedded ECL support in, for example, the Shrimp browser. It supports SNOMED CT implicit value sets as well, which also supports a rich set of features, including ECL-based memberships, reference set memberships, all the SNOMED CT related features that you'd want from a fully fire-enabled system. For LOINC, it supports such features as implicit value sets for answer list. Multi-version support, of course, is crucial, which it offers. And again, the deep support for fire, which is crucial to ensuring that the fire-based specifications across the country are supported by the services that's offered here. Next slide, please. So this is just going a little bit more deeper dive into the resources and operations for the fire terminology resource capabilities it offers. I won't go into all of them, but the key ones I think as a takeaway is for value sets and code systems. And code systems, we're talking about, like, for example, SNOMED CT and LOINC, and value sets are all the pan-Canadian value sets that we publish that supports applications like the patient summaries and the Canadian core data for interoperability. This slide tells you about the different components of OntoServer because it's not it's a suite of tools that make up OntoServer that provide different services and has different features. And for our purposes, we'll go a little bit into two components, which is OntoServer and Shrimp. And OntoServer is the command console, which allows for exploring resources as well as for the syndication capabilities of the fire server. And Shrimp is for browsing and exploring content as well. Next slide, please, Anil. So Shrimp is not unlike browsers that you might have been familiar with in searching terminologies like SearchLink or the SNOMED CT browser, but it's built into our OntoServer and it pulls directly from the code systems that we support, except that it provides content in fuller context that you can see the hierarchy and the taxonomy within the panel without having to navigate to different pages. So it's intended to be sort of a built-in and fulsome view of the concepts that you are browsing. And we've also provided you an access to our service that you can actually go directly. Once you authenticate to an InfoCentral account, you can go in and take a look. Next slide. Another component which we'll touch on but the functionalities of this component is not fully rolled out, and that's Snapper, which essentially is the authoring component of the OntoServer solution. And this allows us to author for code systems, value sets, and to create concept maps. And we'll be looking at this in future iterations as how to roll this out to support our stakeholders. But we just wanted you to be aware that this was part of the offerings of the service, but just not yet rolled out. The Onto command that is the what we'd call the admin console of OntoServer. It's sort of your control command center, if you will. And we worked very hard on this component actually over the last few months to roll out enhanced features of this component, as we realize that we sort of live in an in-between world where not everybody's fully fire enabled, and not all systems might be all fire aware. So we've rolled out capabilities that not only allow you to browse content or to get content programmatically through APIs, but you also have those features that you might have been used to on the gateway, such as browsing content, downloading contents, and comparing contents through Delta files. And these downloads would be available in multiple formats that are user-friendly. Next slide, please, Anil. So our server deployment model essentially is it follows the staging to production workflow, which is really about ensuring that any content our users get goes through an authorized process. So we have an authoring platform that then goes to staging and has a whole suite of approval processes before it gets through to production. And that's the model that we've chosen for this deployment. Next slide, please, Anil. And this is outlining, depicting for you visually what we intend the server syndication to look like. So we would be considered the master server, where we offer source of truth terminologies and artifacts that we manage at the National Release Center that can then be distributed to other instances. Either you syndicate content from the master and you ingest it and use it locally, or like the second option where you actually syndicate and you maintain additional code system that support your own local use cases at the local level. And there could be instances as well where you're syndicating to another version of Onto Server, because we know that partners in Canada have also installed their own server. So this is the intent for the terminology architecture, to have it as a federated model where we're acting as a source of truth for Pan-Canadian approved standards. Next slide, please, Anil. So quickly, we just want to touch on what's next. So we aim to continue to refine the system, to continue to elicit feedback from users as what's working and what the gaps are, and then we work in turn with our partners to develop those advanced features, as well as adding additional terminologies and code systems as required. A key piece of our work next also would be targeting adoption strategies, such as engaging with vendors to ensure that we can expand a syndication and systems integration for programmatic use of the service, which is where we see the key value added for a service like this, not just doing it the old school way of downloaded content, but we want to really get out there to ensure that the adoption levels are increased at the system integration level, and we'll do that with more engagement with vendors and developers on the service and the value proposition for all our stakeholders in Canada. So I know I wanted to do a quick demo, but in the interest of time, I've provided a lot of content that takes you to a lot of our services with user guides and videos. So you will have resources to look at that. So we won't be able to go into a demo today, but I just wanted to thank you for your time, and then I'm going to pass it on to my colleague.